In vitro embryo culture techniques, single-step versus sequential culture systems. In assisted reproductive technology, ART, particularly in vitro fertilization, IVF, embryo culture is a crucial step to ensure that fertilized embryos develop optimally before being transferred into the uterus. The success of embryo development largely depends on the culture media used, the environment, and the culture system. The two main types of culture systems used in IVF are the single-step culture system and the sequential culture system. Both systems aim to provide the necessary nutrients and environmental conditions to support embryo growth, but they differ in how the media and culture conditions are applied throughout the embryo development process. First, single-step culture system. A single-step culture system involves the use of a single type of culture medium throughout the entire duration of embryo culture. This system is designed to maintain optimal conditions for embryos from fertilization, day 0, until embryo transfer, usually day 3 or 5. Features of single-step culture system. Uniform culture medium. The same culture medium is used from fertilization to embryo transfer, eliminating the need to change media or adjust conditions during embryo development. Simplified protocol. This system simplifies the IVF protocol by reducing the number of steps required for embryo culture. It is easier to implement and requires fewer resources. Simplicity and cost effectiveness. It is cost effective and easier to handle because there is no need to adjust the culture medium or transfer embryos to a different medium after fertilization. Advantages of single-step culture. Consistency. Since the same medium is used throughout the culture period, it provides consistent conditions for the embryo, which may help reduce environmental stress. Convenience. The system is easier for the laboratory to handle as it requires fewer changes in culture conditions. Reduced risk of contamination. Fewer handling steps reduce the risk of contamination or human error. Limitations of single-step culture. Lack of specific nutrients. Single-step culture systems may not provide optimal support at different stages of embryonic development, as embryo needs can change as they progress from cleavage to blastocyst. Limited customization. Since the same medium is used throughout, it may not offer the specific nutrients or growth factors that embryos require at certain stages of development. Second, sequential culture system. In a sequential culture system, embryos are cultured in a series of different media over the course of their development. These systems provide different nutrients and conditions at each stage of embryo development, starting with the cleavage stage, day 1 to 3, and transitioning to the blastocyst stage, day 5. Features of sequential culture system. Multiple media stages. Different media are used at various stages of embryo development. Cleavage stage, day 1 to 3. Embryos are cultured in a media designed to support early development with a focus on cell division and metabolism. Blastocyst stage, day 4 to 5. Embryos are then transferred to a different media that provides nutrients required for blastocyst formation, such as amino acids and growth factors. Stage-specific nutrition. Sequential systems are designed to provide tailored nutrients at different stages of embryo development, which may enhance embryo quality and implantation potential. Advantages of sequential culture. Optimized conditions. The embryos are cultured in media designed to support their specific needs at each developmental stage, which may improve embryo quality. Higher developmental potential. Studies suggest that sequential systems may promote the development of embryos to the blastocyst stage, which has better implantation potential compared to cleavage stage embryos. Improved selection. By supporting embryos through their natural development stages, sequential culture systems can increase the likelihood of selecting higher quality embryos for transfer. Limitations of sequential culture. More complex protocol requires more monitoring and adjustments as embryos are transferred to different culture media at different stages. This can make the process more labor-intensive and time-consuming. Increased risk of contamination. Each transfer between culture media increases the potential for cross-contamination or embryo handling errors. Cost. Sequential culture systems may be more expensive due to the need for different types of media and more extensive laboratory management. 3. Comparison. Single step versus sequential culture systems. Aspect. Single step culture system, sequential culture system. Media used. One culture medium throughout the entire process. Different media for different stages. Cleavage, blastocyst. Simplicity, simple protocol with fewer steps. More complex requires transferring embryos to new media. Customization, limited to one set of nutrients for all stages. Tailored nutrients for each developmental stage. Cost, more cost-effective, fewer resources needed. Higher cost due to multiple culture media. Handling complexity, easier to handle with fewer transfers. Requires more attention with possible risk of contamination. Embryo support, uniform support but may not meet specific developmental needs. More targeted support, potentially improving embryo quality. Embryo development potential may not fully support blastocyst development. Supports optimal development for blastocyst formation. Risk of contamination, lower risk due to fewer transfers. Higher risk due to multiple media changes. 4th, factors influencing the choice of culture system. Embryo. Quality. Poor quality embryos may benefit from sequential culture systems as they provide targeted support at various stages. Patient age. Older patients may benefit from sequential systems due to their ability to promote development to the blastocyst stage, which has higher implantation potential. Clinical history. Couples with previous IVF failures may benefit from the more controlled conditions provided by sequential culture systems. Laboratory resources. Labs with limited resources or less staff may opt for a single-step culture system due to its simplicity and lower cost. 5. Conclusion. Both single-step and sequential culture systems offer distinct benefits and drawbacks depending on the needs of the embryos and the resources available in the IVF laboratory. The single-step system is easier to manage and more cost-effective, but may not offer the same level of developmental support as the sequential system, which optimizes embryo development by providing stage-specific nutrients. The choice of culture system should be based on factors such as embryo quality, patient age, clinical history, and available laboratory resources.